probably up to 8 feet inside the building. The water was up that high, and it's got within about 8 feet of the roof of the hospital. So, you know, tremendous damage was done. I would say pretty much every piece of equipment that we had inside was ruined, and just a lot of mud, a lot of silt, rock, trees, anything you can think of. When you have that kind of water coming through here with that much force, it just tears everything up, and it was just pretty much decimated inside.
I know that you mentioned the equipment as well. How much of a financial loss is this?
We don't know yet. We're still actually calculating that. I think we built the hospital back in 2018, and it was over $30 million at that point. And so, you know, I don't know if it's a total loss, but I know that there was a large amount of damage that was done.
The employees who were here, have they been placed?
They have. Every employee, many are actually working here at an urgent care center, and others are placed within the system. We were very careful to make sure that all those folks that were working here had a place to work when they left here. So that's very important to us. I know this is hard on this community. My father grew up just over this mountain right here, up in a hollow up here. And so I guess the message is we're committed to Unicoi County and to Irwin. We love this community. It's very important to us. I mean, this is our community too. And I guess the message would be that we're committed to rebuilding and having another facility here. And we look forward to that in the near future. It's going to take some time. I asked them just to bear with us, be patient. We want to get their input. But we love this community. We want to be a part of it forever. We really think this is important that we come back strong, rebuild strong, and we take care of the people in Irwin and Unicoi County. You know, the flood that we saw probably is a flood that would happen in what we're saying 1 in 1,000 years. And we actually built this utilizing engineers and architects and people who felt very comfortable that this was a very safe place. And we actually built it at the same level as the interstate, this right here. And so I think we felt very comfortable that this was going to be a safe place. This flood and having a hurricane impact East Tennessee is pretty unique. And so we're sorry that this happened at this location. We love this hospital. But again, we're going to rebuild and just going to make it stronger. And I think that we felt comfortable being here because of our proximity to the interstate. And normally interstates are built in a place where it's safe from flooding.
How has the loss of this hospital impacted the other hospitals that you run in the area?
Well, certainly patients, inpatients especially, are having to go to Johnson City Medical Center or to Sycamore Shoals Hospital. So that's what we're seeing most of that happening. We do have 24/7 urgent care open, staffed by emergency physicians and nurses that had worked here before. And so we're hoping to alleviate some of the pressure off those hospitals from the patients that can go there for care. But many of the patients that are living in this community today, or people who live here today, have to go to one of our other facilities. So we probably saw somewhere around 6 to 8 patients on an inpatient side, and we had a busy ER here. That's why we tried to reopen the emergency care center as quickly as possible. We have plans. We're just now starting to look at that. No location as of yet. We want to. We have to really clean up this site and make sure we kind of know the full damage here, and then we'll start looking for another location in the area to rebuild. But as of yet, we don't have a location yet.
Will this building have to be razed and torn down completely?
I don't know that we know that completely yet. We're still assessing the site, and as you just walked through it, you saw the damage that was done. There's a lot of assessment that has to be done by contractors that we partner with to make sure that we know what the next step is with this building.
That's good.
One more question.